Harjit Singh Bhatti is a Director of Internal Medicine. He's also National President of the Progressive Medics and Scientists Forum. Dr. Bhatti, thank you so much for your time. Can we just pick up on what Liz ended almost that report with? Did India take its eye off the ball? Let me give you a quote from Jishnu Das, who's a health economist at Georgetown University, one of the most famous universities in the world in the United States. In early February, he said it's not that India is testing less or things are going unreported. It's been rising, and now suddenly it's vanished. I mean, hospital ICU utilization has gone down. Every indicator says the numbers are down. I mean, this is a health economist at Georgetown University saying that the virus has disappeared in India. It hadn't, had it?
Yes, but if I will tell you the true reality, if you talk about in the January, like the starting of January or the mid of January, means I am posted in a COVID ward since last 1 year. And in the mid of January, we have only one patient left of COVID patient. So there is definitely a downfall to the COVID patient load. That is true. But the thing is that after that, and there is no measures taken to stop that virus at that level. Like even the vaccine program was promoted as not as a preventive measure but as a treatment sort of thing. Like if now a vaccine came, now no one will get infected. So these type of strategies was taken by the government, which has resulted into like a laxity by the public also, and there is definitely an ignorant behavior by the government, which has resulted into a second wave. Now the second wave is resulting much more destruction than the previous one.
Has India managed to understand what this double mutation of the virus that is called the Indian variant is doing to transmission and to the severity of COVID-19 in patients that develop the disease?
Yes, means now there is much more focus on the mutant strains, and now we are our government is also focusing on that strains. But the issue is that there is no active measures was taken to like to break the chain of transmission or to to promote mask and other things in the by the government. And we have seen that even our policymakers, our government, our ministers, they are more involved into the election rallies and other things rather than being focusing on the scientific part and of stopping the coronavirus. So that's why and these things were there. Our scientists, doctors were understanding about the mutant strains, but now the situation is not very good.
What is it like for you and your colleagues working on a COVID ward? How are you able to keep yourself safe? How desperate is the situation in terms of the medical work you're doing with these patients? What's it like for you when you go home, back to your neighborhood?
A situation is very alarming and it is very exhausting now. I can tell you that I'm not talking about the duty hours. In duty hours, yes, we are looking after almost 3 to 4 times more patients than we were used to look after previously. But even after that, when I reach home, then also so many people make call to us and says that please arrange beds for us. Please tell us how to manage patient at home. Even people who are managing patients at home with oxygen cylinders and with other parameters, they are even giving injectables, like even remdesivir was given at home. So all these management they are doing, and they repeatedly call a doctor, like they call us and ask for consultations. So it is a very exhaustive procedure. Since I can tell you from last 10-15 days, we were not even a single minute we had for ourselves. We are continuously talking on phones or managing patients in the hospitals. So it is a very exhaustive procedure, and I have not seen this type of exhaustive workup in my entire medical lifetime. So this is very exhaustive.
Doctor, I'm sure everybody watching wishes you the very best, and all of your fellow professionals who are fighting this as cases rise in India. Dr. Harjit Singh Bhatti speaking to us from India.